walk into my patient's room, I'll have my gown on and my mask, and then when I walk in, I'll put my goggles on and gloves. So, hey, Mr. Jones, how are you? Good. All right. So let me move my desk. I'll place my goggles on. Perform hand hygiene. How are you doing today? All right. Can I have your first and last name and your date of birth, please? All right. Do you have any allergies? You don't? Okay. So I'll be changing your dressing today. Is that okay with you? Okay. Do you have any pain? You do. Okay. In your abdomen? Does anything make it better or worse? Okay. Your medicine makes it better, and then movement makes it worse. Okay, does it stay in one place or does it radiate to other places? Okay, it only stays there. On a scale from 0 to 10, would you mind telling me your pain level? Okay. Does it affect your daily living? It does not. Okay, so I'm going to grab some gloves and get ready. Alrighty, so lower this. Alright, so I will only uncover the portion that I will be changing. I'll grab my bag. Okay, then have my tweezers open. Okay, so I'll slowly begin to peel, and I'll be smelling for any odor. There is none. And then I will assess it, and there is minimum drainage, which means it is scant, and there is granulation, which means that it is healing. Then I'll grab my tweezers, slowly remove this, throw it in the bag. I don't need this one. Okay, and next I will measure the length, the width, and the depth of it. So it is 5.5 inches long. I will document that. And then I'll measure the width, the longest part. So it is 1 inch in width, and I'll now hold on to this one. Next, I'll measure the depth of it. And you go down into the deepest part, and then you measure, and it is 1 inch in depth. So I will throw these away, and I will remove my gloves. Okay, and then perform hand hygiene. And before I do anything else, I forgot to palpate, so I will do that real fast. Let me grab my glove. And I would be checking for any ridges. Okay, so I'll palpate around, and there are no ridges, so that is good. Okay, now I can get rid of these. Perform hand hygiene one more time, and I will set my sterile field. Okay, so I will place these in order, and first I'll get my tape ready. So I'm going to be cleaning his wound first, and then I'll with this one. Okay, so once I open my sterile field, I will not break it. So throw that away. And I will only move around it on the outside. Okay, so place this one here, this one here. My sponges will go here. So I would place normal saline into our gauzes. So we would just open. Okay. And I would pour some in there. So now I need my sterile gloves. So let me grab those real fast. Give me 1 second. I forgot my gloves don't set. Grab these. I'll open. And I'll put my dominant ones on first for my dominant hand. So I'll grab. Okay, and then I'll cuff under. Okay, then we can do just like this to make sure they are on. And I'll pinch in the middle, get rid of those. Okay, and now I'm ready to clean. So I'll grab one and I'll clean in the middle and I'll get rid of that one. I'll grab another one and clean on the outside. Get rid of this one. Make sure my trash. Then I'll grab another one and clean on this side. I'll get rid of that one. Okay, and next I will place this one inside the wound. So I'll start right here. Make sure we don't touch the skin. Okay, and then I'll get rid of that one. And I will place 2 dry gauzes on the top. And then I will place this one just like this. And now I will tape it. Okay, and I'm now done changing his dressing. I'll clean up my mess. And throw all of this in my bag. And throw this away. Throw this away as well. And then I'll take my gloves off. Throw those away and perform hand hygiene. then I would cover him back up, and I would take my trash with me and throw it in the correct container, and then take this off when I walk outside the room.